Zeno. Would you like to lead us in the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome to the May 14th Board of County Commissioners meeting. On my left is Commissioner Aaron Mays, who represents District 3, and on my right is Commissioner Kevin Cook, who represents District 2. I'm Bill Rippon, and I represent District 1. And what is first on the agenda?
First is item 1, proclamation and presentation, COVID-19 update. Dr. Gianfranco, please.
Good morning. I'm here again to talk to you about the status of our pandemic response and the status of the infection and the pandemic distribution in Shawnee County. I'm going to start by showing you some charts, and these are taken from different sources, and many of them come from an internal tracking system that we have created using spreadsheets and other tools, and that we review on a daily basis to monitor and track the spread of the infection. We are planning, as I said, it was created primarily for internal use, but we are planning to release some of these charts now on a regular basis every week so that everybody can see where we are. So let's start with the number of cases, which is, of course, the first thing that people want to know, how many cases we have by week. A couple of caveats here. The date indicates the first day of a week. So we are now on the week of May 10th, and as you can see, of course, the data for May 10th is still incomplete because the week is not over, but you can see that we have had an increase. So our peak was on the week of April 5th with 43 cases. Then we had 2 consecutive decreases, pretty sharp decreases, and we went down to 10 cases, and then we went up for 2 weeks in a row, including last week. Preliminary data from this week, I would guess we are probably going to be just about the same level as last week, but a lot of things may happen in 2 or 3 days, so I really don't know. So obviously the number of cases diagnosed is affected by multiple factors, one of which is how much testing we do, and we'll talk about that in a moment. The other is, of course, how much disease there is in the community, and then also the presence of small outbreaks, because when we have a small outbreak, say in a restaurant or in a nursing home or in another business, we have to test more people. So that may also, and we find more cases, so that may also affect the number of cases. This is a disease rate map. This is taken from the Kansas Department of Health and Environment. So what you see in those numbers, and I know it may be a little hard to read, is the case rate per 100,000 people. So for every 1,000 people. For every 1,000 people who live in a certain county, how many cases we have. And you can see the dark colors are the counties that, of course, have been most affected by the pandemic throughout the state. You can see now here in southwest Kansas, that's really the hot spot with the meatpacking plants, with rates that go to 30 or plus cases per 1,000 people. You can see Wyandotte County is pretty high, 6.6. Leavenworth is pretty high. Now Leavenworth also has the correctional facility, so that affects their count considerably. Shawnee County is at 0.9, which is medium high, I would say. You see Johnson County, which being in the Kansas City metro area has been affected heavily, as a rate just slightly above ours. Douglas is below us. When you go into small counties like Waubonsee County, those are small counties where even just a small number of cases may bring the rate up. In this particular case, in Waubonsee, there was a cluster of cases in a certain business, and that creates a rate that's higher than expected. But essentially, this is really the best way to know, based on information that we have, how much disease we have in our county. So it's not the percentage of positive tests, we will talk about that in a moment. It's really the disease rate per 1,000 population. And this is not how many tests we do every week. So please disregard the week of May 10. As I said, some of these charts are a little rough around the edges, and what I mean by that, they are accurate to the best of our knowledge, but they're set as an internal tracking system. So we already have the current week there as May 10th, but of course the week is still not over. So, and there is a delay for the tests that are done to be included in the system. So that number under May 10th, really, you shouldn't even look at that. But the numbers for the weeks before are pretty complete. And you can see that we did have a pretty substantial jump last week. And that is accounted for by several, at least in part, by several reasons. One is that our hospitals went back into production, so to speak, and they started some elective procedures, and they have internal processes to test people and staff before those procedures are implemented. So we estimated that at least 300, possibly more, additional tests were done by the hospitals, and we talked to them yesterday, as a result of that enhanced testing process. And in doing that, by the way, they test a lot of asymptomatic people who do not have a symptom. So if you think about the positivity rate, which we'll look at in a moment, if you test people without symptoms, it's less likely that you find positive tests. So the positivity rate will go down. So really, that's an example of how testing, not only the amount of testing that we do, but who we test really affects the positivity rate. The other thing that happened last week that can at least in part explain why the sharp increase from 703 to 1223 tests done is that we have a couple of clusters or outbreaks in Shawnee County, and some of you know about that because at least in one case we had to make a public announcement. And there was the food court in the Turnpike, and then we have another one. And so when we have a cluster like that, we test more people. And there were probably at least, I would say, 50 or 60 people that were tested out of those two outbreaks. And then in part, it's likely that there was an increased testing, just because that's the trend we want to see. We are encouraging our providers to test more and more. The criteria for testing have changed, upon recommendation from KDHE, and now anyone who has any one symptom in a list that is pretty much longer than the one we had originally is eligible for testing. So still primarily symptomatic people who are sick, but they don't need to be as sick as they needed to be at the beginning of the pandemic to get the test. So for this reason, you see this increase in testing. And this is a percentage positive labs by week of tests requested. And again, please ignore May the 10th. I should have put a red cross there so you wouldn't see it. But you see that during our peak on March 22nd, that was the peak of positivity rate. But however, that was also the peak. Let me see if I can go back here. So look at this. This is actually interesting. March 27, we only have 235 tests done, right? So very low number. And that's when we have the highest positivity rate. Okay? So the positivity rate in many cases goes in the opposite direction as the number of tests. And that makes sense if you think about it. If you start testing the people who are really very sick with symptoms that are really very suggestive of coronavirus, you're likely to find a higher proportion of those people who are actually positive to the test, right? The more you broaden your net, you cast your net broader, the more people you bring in that may have coronavirus or may have something else. And so as a proportion of all the tests done, the percentage of positive tests goes down. That's why you see in May 3rd, so last week, that's when we have the highest number of tests, remember, 1223, and we have a lower percentage positivity because we tested more people. I just told you the hospitals were testing more people, and these people were asymptomatic, so it's less likely that we find sick people, positive people in that group. But this, for all those reasons, this chart should not be interpreted as an indication of how much disease there is in our county. This just reflects primarily testing patterns, and secondarily, also how much disease there is, of course. If you do the same number of tests in New York City today, you will find a higher positivity rate than in Shawnee County. But there are so many other factors that affect the number that it's really not the number you can use to judge the spread of the disease in the county. Moving away from labs, this is a percentage of confirmed cases with no known source of infection by week. As you can see, that has gone down, and that's what we want. So these are cases, these are people with confirmed disease for whom we do not know where they got it. Again, ignore May the 10th, that has no meaning right now. But you can see in the last 3 weeks, we went down from 40%, that's pretty high. 40% of people that we don't know where they got infection, that's pretty high. Went to 21, we went to 12. So that's a positive trend. Still about lab testing, this is the lab testing rates by county, and I know it's very small, but this is again published by KDHE. So this is how many tests are done per 1,000 people, both positive and negative. And we want this to be high, because we want to test, we want to test, we want to test. And Shawnee County is pretty decent shape. We have gone up. We were always in the upper, 3 to 5 counties in the state. Now, of course, we have counties where you have these large outbreaks, so the testing rate in those counties is going to be much higher than anywhere else. But we are at the level of 23.2, which is higher than Johnson, higher than Douglas, and higher than Sedgwick. So it's a pretty good number. I'm satisfied with that. This is the age group distribution. As expected, adults and older adults have the highest percentage of cases that are reported. Ordinarily, in other places, you will see these columns here on the right as being higher, the 65 plus. And we don't see that in Shawnee County. And the reason is because we have not had any major outbreaks in nursing homes. And that is really remarkable. It speaks volumes to the great job that our nursing homes have done, the great job that our staff at the health department has done. Since the beginning, we have appointed a nursing home coordinator within the staff at the health department because we recognize the risk of nursing homes for the spread of disease. And we have had sporadic cases in a few nursing homes, but no outbreaks. Now, it may happen. It may happen because we know we have virus circulating out there. And we know, and I will give you a couple of examples later, we know that even with the best precautions, people may become infected. But right now, we've been fortunate enough that didn't happen. So that's why the age distribution is a little unusual, because you have the older groups that haven't been represented as much as in other places. These are hospitalization numbers by age group. So the yellow-orange portion of the bar represents, for each age group, the percentage of people who were infected in the age group that was also hospitalized. As you can see that the older the people, the bigger that bar, with the exception, again, of 75 and older. And the reason is that we haven't had many cases in nursing home. Those are the people in those age groups that would be most susceptible to being hospitalized because they're already in nursing home. So probably not only are they older, but they have other risk factors besides being older. So probably these people here are people that were relatively healthy in those age group of 75 and older, and that's why not many of them were hospitalized. But you can see that there were some people hospitalized also in younger age groups at 35 and even what is that, 16, 18, 24. This is number of hospitalizations, so new hospitalizations per week. We started to track this only last week. That's why we only have 1 week of data. Again, disregard the data for the week starting May 10th, because that's our current week. And last week we have 5 new hospitalizations. And this only includes Stormont Vale and KU St. Francis. It does not include the VA. This is the average capacity for ICU bed, daily capacity for ICU bed per week. So we take the daily capacity every day. In the previous week, we take the average of that. So last week, on average, we had 36 ICU beds available in our 2 hospitals for COVID-19 patients. Okay, that's enough for the data. And I will tell you now, towards the end, I'm approaching the end, so don't panic. It's not going to be much longer. I will tell you a little bit of interpretation of the data. I know there is a lot of talking about herd immunity, and so I want to clarify a few things. It's a very interesting concept. There is nothing wrong with herd community. It's good. Essentially, what herd community means that we build immunity in the population, and you can do that in 2 ways. You can do that through natural infection, when the infection stimulates immunity, long-term immunity. And the second way to do that is through a vaccine. That's what we do with the vaccine, right? We just stimulate immunity in the population. It is a good concept if it is applied in a controlled way, especially when you do that with natural infection and not with a vaccine. The vaccine is less problematic. One major thing to keep in mind is that right now it is unclear how much immunity is generated by this virus. So we know that the virus triggers the production of antibodies. That much we know. And we know we can measure those antibodies, although the measuring systems and the tests that we have are very imprecise. What we don't know is whether those antibodies actually protect against the virus and whether that protection is long-term. The 2 things are not equivalent. Think about common cold, which is, by the way, caused by another coronavirus. We all know you can get a common cold again and again and again. But if you measure the antibodies after a common cold episode, you will find antibodies in people who just recover from the common cold. That does not protect them. The antibodies are there, but it doesn't protect them against further infection. So we don't know what's going to happen with coronavirus. So for that reason, this idea of just allowing the virus to go through our community and take care of stimulated immunity, if it's done in an uncontrolled way, it can lead to really very high infection rates, high death rates, and it's unclear if it will be helpful in the long run because we don't know if that immunity is actually long-lasting. So here are some projections of what would happen if we just let the virus take care of this and build herd immunity in an uncontrolled way, just using natural infection. The first thing that we need to know is how many if we want to do any kind of projection of mortality, how many people infected will actually die. As simple as the question appears, it's a hard question to answer right now because we just don't know how many infections there are out there. This is a novel virus. Remember, it's a new virus, so it just started, and we don't have any historic data. What we do have is data that were built in China, in Italy, in Europe, in Spain, in England, in other places. And so people have done all sorts of studies, and there is a range of fatality rates, so proportion of people who have an infection who die. The lowest rate is 0.1%, and that's based on a limited sero survey done at Stanford University. Now here is the limitation of the sero survey. Sero survey is when people measure antibodies in the blood. And if they find antibodies against coronavirus, they say, hey, these people were infected and they never showed symptoms. So then they count how many people die from coronavirus, and they take a proportion, and that's their mortality rate. The problem with that is that those antibody tests are very new. And we don't know if they only pick up antibodies against the COVID-19 virus, which is the current virus, or if they also pick up antibodies, at least in part, against other coronaviruses, of which we have a high number, including, as I just said, the common cold. So if you think about that, then if those antibodies are not just antibodies against the COVID-19 virus, but they also include antibodies against other types of viruses, then we will have a number of people infected, an estimated number of people infected that's higher than the real. So then our mortality rate will go down, artificially go down, because we increase the denominator, but the denominator is not accurate. There are other studies. So on the opposite end, we have 1.3%, which is an estimated based on multiple studies that were reviewed by researchers of a fairly prestigious journal, which is called Health Affairs. And then there are other estimates in between. I don't have that number here, but the current death rate in Kansas is 2.2. So that's not an estimate, that's an actual measure. And that's the proportion of patients that are reported as being infected who die. But we know that 2.2 is not the actual mortality rate because, again, many people will not be recognized as infected. And also many deaths will not be recognized as due to coronavirus, even though they were due. So that's why people go through this exercise of having these projections. So if we were using this projection, if we take the lowest number ever published, 0.1%, you need about 60% of the population in any place, let's say in Shawnee County, infected before you can build herd immunity. With the lowest number, 0.1% mortality, you would have 105 deaths. With the probably more likely number of 0.5, with 0.1, you will have 105. With 0.5, you will have 525 deaths. With the number estimated by Health Affairs, which many people actually agree more with the number than with other estimates that have been published, it would be 1,365 deaths in the county to reach the level of herd immunity that we need to reach in order for our community to be protected. Another way to look at that is that in practice, and this is another study published by University of Berkeley in California very recently, the probability of dying, if you just rely on herd immunity, will roughly double at every age. Because of course the probability of dying is different from age group to age group. But in every age group, people will have twice the probability of dying if we just let herd immunity go uncontrolled. There was a study done in Italy in the most affected region in Lombardia, which is where Milan and Bergamo and some other towns are. And they did something very smart. Italy has an excellent national vital statistics system. So they looked for each locality. They took the average number of deaths during the months of, I think it was March and April, in the previous 5 years, and they took the average of those 5 years. So they said, on average, since population structure hasn't changed very much, on average, in the past 5 years, that's the number of deaths we have, that's the number we would expect of deaths this year, except that now we have a coronavirus. So any kind of difference is most probably due to coronavirus. And they found increases were anything between 17% and 294%. And that was with all the mitigation activities and stay home and that's actually what I call a lockdown, what they did in Italy, when you really could not leave your house without having papers that explain why you're leaving your house. And even in that way, they saw the huge increase of up to 294% of deaths compared to the 5 previous years. So herd immunity can be good if we use it in a controlled way. It can be devastating if we use it in an uncontrolled way. Let me wrap it up by saying what are the strengths and what are the challenges that we currently see in our county. Here are some strengths. First of all, we were very aggressive, thanks for your support also, thanks to your support, in implementing mitigation activities early. And we were the first in the first 2 counties who shut down the schools before that was done at the state level. We stopped public gatherings, the first country that did that. That is paying off in terms of lower number of cases. Our hospitals are ready for surge capacity. They are ready. We have 2 top-notch hospitals. I can't speak highly enough of what they're doing, and they have ramped up their ICU beds, they have enough ventilators, they can face a surge capacity within certain limits. Our proportion of cases from unknown sources is relatively low, and what that means is that our public health folks are doing an excellent job in tracking down each and every case that was confirmed, with a few exceptions, of course, and that's a proportion of cases from unknown sources. Some remain unknown, but it's lower than other counties I've seen, and it's going in the right direction, meaning it's going down, so that's a good number. We had no major outbreak in nursing homes, we talked about that, and we have new testing and surveillance activities that we are ready to deploy next week. It took a lot of work, thanks to Linda and her staff, but finally we will have a team of people from the health department who will be able to collect specimens and submit specimens for testing to the Kansas Department of Health and Environment. And this team will operate in 2 ways. One will be a mobile team, meaning that they can go to any locality where that needs to happen. Let's say we have an outbreak in a retail business. We want to test all the employees, which is what we did last week. it was a nightmare. It was, I shouldn't say nightmare, that's a little exaggeration. It took a lot of resources from our staff because we really didn't have, we didn't have this team put together, so we had to rely on our providers, our hospitals to do that for us, and logistically it was very complicated. That would be much easier moving forward. The other thing that this team is going to do, at least a couple of times a week, they will place a tent in different parts of our city where we know that there are probably more cases that are unrecognized. And so we'll try to improve the number of cases that come into the testing system. And I wish I brought with me, and I forgot to add it at the last minute, we are building a map, actually, of the distribution of cases in the community, and so it's already very clear where, it's called the heat map, you've probably seen those, so the color changes of the heat changes depending on the number of cases you have reported from each part of the town. I can already tell you, it's Central Topeka, North Topeka, and East Topeka that are the hottest spots. But that's not where most of our tests, most of the people who are tested come from. So that's what our testing team will be able to do. And we have also finally some surveillance activities that are going to start. We have made some arrangements with some large employers in town, or in the county, I should say. And they will let us know at least once a week, or perhaps even more frequently on a daily basis, how many unplanned absences they had among the workforce. And that's a crude indicator of, are people getting sick? And you know, there is a baseline we have to build over a period of few weeks, but then when you start seeing a spike, then we have to investigate. At least it's an early sentinel indicator of what may happen in the community. Here are the challenges. Despite everything I've said, the number of cases is increasing, and we can't deny that fact. And it has gone up the previous 2 weeks, and I don't think it's going down this week. There is, I think, a growing source of complacency and non-compliance among the public. I've noticed that. I don't know if you've noticed that. Just we have reports of people. I am personally receiving reports from sometimes people I know, sometimes people I don't know, say, I was in this place, and people are not doing social distance, and I think that's becoming more common, in part because people are tired, in part because despite the fact our number of cases is increasing, it's still pretty low. So reality is most people still, they don't have any direct experience of what this virus is doing. There is distrust in government actions. That has always been there, but it becomes particular serious problem when we have to work with minorities. And that's the next bullet. We have an increase in the number of cases among minorities. And so when people are already suspicious of government intervention, the last thing they want to do is talking to somebody from the health department and obey orders from the health department to stay home. And in fact, we have had already more than one cases who have gone underground. We found them the first time, and then we didn't find them the second day when we checked on them. We don't know where they are. There is the unknown effects of increased social mobility. Remember that the effects of reopening part of our economy in our community will start to be apparent towards the end of this week and into next week. So we still don't know what those effects are going to be. Contact tracing, and these are the last two bullets, and these are in my mind the most important ones, especially for this board, because you have a direct impact on those. First of all, contact tracing is a complex and resource-intensive process. That's what our nurses have been doing for several weeks now. Linda can tell you the details of all the internal reorganizations that she made to make sure that contact tracing is done well. It's essentially all hands on deck right now. That effort cannot be sustained in the long term. It just can't. People are getting worn out. People are going to start quitting. They are not quitting yet because they're dedicated employees and they made a choice. They know that they sign up for something like this. But I have no doubt that if we ask them to keep doing what we are asking them to do right now, this is not going to work. So the public health capacity is really stretched thin. And I think that soon this board will have to make some tough decisions about how to support the public health capacity. There is a lot of talking about the hospital capacity as a good indicator of how much we can afford to have this pandemic grow in our community. I don't think there is as much discussion about the public health capacity, but let me tell you, we can have all the ventilators, all the ICU rooms that we can have. If we are not able to track cases and their contacts, essentially what we are telling people, you're free to go out, and if you get sick, we have an ICU bed for you. Just go to the hospital. I don't think that's really a good policy approach. We must be able to contain this infection to levels that are sustainable for our community, that are sustainable for our economy, so that people are not scared to go to work, and people are not scared to go and be patrons in restaurants and businesses. Otherwise, the economy will not grow. That is a core function what public health is doing now. It's a core function that we must protect. If we lose the ability to track cases and contacts, essentially the virus is free to go and we go back home. So how do we move forward? It has to be an exercise in balance. We need to balance the need for our economy. We need to send people back to work. We need to balance that with the need to have a control approach to how we do that so that the virus doesn't get out of control. So for this reason, we have decided that if the state allows that, and we don't know if they will, Shawnee County is planning to progress into phase 2, starting on Monday, which is the earliest day we can do that, and that we will put some additional restrictions, just because of some of the challenges that I listed earlier. Our number of cases going up, we don't want to go up to the point where we really can't manage it anymore. And so the size of public gathering for now will not change. We remain at 10, which is where it is now. The maximum public gathering size that's allowed in phase 2 is 30, but we will not go there for now. And we will adopt an ordinance, a local ordinance that will include some additional requirements for some select businesses that we consider as a high risk of transmission. And finally, we make an effort to tighten the enforcement. Once we put those recommendations into an ordinance, that's really the law as far as local law is concerned. And so we will ask for law enforcement to assist us when cases are reported of people non-complying with those laws. We will ask law enforcement to make some interventions, primarily with an educational purpose. Please understand, and I think you heard me saying that, I have no intention and no desire of putting people in jail. Although I suppose if really it comes down to that, if we had to do it, we are ready to do it. I really don't want to do it, and I hope we won't have to do it. But I see more an educational opportunity for somebody with a uniform to go and, they see a gathering that's greater than 10 people, which is what the law will allow in Shawnee County next week. Say, hey guys, what's going on? You know that, I can't more than 10 people, you're social distancing, and same thing for a retail business. If, people are doing something that's non-compliance with our law, I think there is more enforcement that can be done. That's all I have, and here standing for questions.
I have a couple questions. You've talked about what would happen if we had herd immunity. If we stay the course we're doing now, will the same amount of people be infected eventually, say in a year, as you have in herd immunity?
If we do not have a vaccine, possibly.
Would you have the same number of deaths? Would it be
Possibly, but it's going to be spread out. And there are two things you need to keep in mind. We always said when we started this activity, our goal is not to stop the virus, because we already knew we were not going to do it. Our goal is to slow down so that we can manage better. Part of management is having treatment and having a vaccine. We already have a very promising drug that is going to be tested. It's actually being tested already. And we have a vaccine that apparently may be deployed in a year or so. So the more we can spread out that natural infection in the community, the more able we will be to control it, treat the people, use new drugs, and finally, hopefully, use the vaccine to build that herd community and not just the natural spread.
how long does it normally take to develop a vaccine that's available?
A vaccine,
Yes.
12 to 18 months. I know that they are in a very fast track, and the most credible, it depends who you want to listen to. The most credible sources, I hear them talking about a year from now.
You talked about gatherings of 10 people. You say that's an ordinance? What gives you law enforcement teeth to break up a group of 10 people or more? What
That will be in the ordinance that we are planning to release for
and
phase
that
2.
ordinance is adopted by who? Is that?
That is the ordinance of the local health officer. The local health officer by law, by state law, has the power to issue ordinances or orders. I don't know if the ordinance is the right term, but it's an order signed by the local health
The
officer.
authority came from, okay. Any other questions?
Yeah, I'm sorry, ordinance is probably not the right term. Yeah, my attorney here should probably correct me. It's an order. Yeah,
It's an order,
thank you.
not an ordinance, okay.
Yeah.
Mr. Chairman, Dr. Pizzino, we're sitting here distanced as the commissioners. Some of us have masks, some of us don't. Just some of your thoughts in public gatherings like this, should we all be masked up even if we're needing to speak for clarity? Is distance appropriate to be able to have my mask, and so that if I need to put it on, if somebody's coming closer to me? I think maybe from the CDC's released different statements at different times, and so even for those of us that are watching the news and involved on local government, it's very confusing as to what is best practice.
Yes. Masks can be confusing. I agree with you. And the thinking about masks has evolved the more we learn about this infection. As you may recall at the beginning, most public health people, including myself, I wouldn't say we were discouraging the use of masks. We were saying, use a mask if you want, but that's no replacement for any other, social distancing or precaution measures that we recommend. We are still saying that, but we're also saying you should use a mask in addition to those measures. And what the mask does, protects people around you, simply put. It doesn't protect you, it protects people around you. So, in practical terms, I think the arrangement you have now, it's okay. I would like to see maybe a little bit more distance between commission meetings. But the 6 feet is appropriate for a gathering of this type. I would recommend that you wear a mask immediately after you end the meeting, before you leave your desk. But the mask becomes, in my opinion, really important when somebody has contact with a high number of people throughout the day. And I'm thinking particularly of workers and employees in retail industry. Think about anybody working in a department store, in a grocery store, in a restaurant. They see dozens, they come in close contact with dozens of people every day. If any of these workers is actually transmitting the virus without wearing the mask, potentially he's infecting all those people that he comes in contact with. So that's where I think the mask issue is really absolutely critical, is for people who work in contact with the public. Everyone else, yes, you should still need it, but at the end, if you're taking a walk with your dog and you are alone, I wouldn't wear a mask. I wear a mask when you go out in public.
And I just want to go back to a point you made earlier. There have been a number of times this past week that I've had individuals stop me or contact me, and they always have the same comment. Of course your numbers are going up. You're doing more testing. But what you're telling us today is the number of testing is not a direct correlation of the numbers going up.
No. You are absolutely right. What I'm telling you today is that the number of testing may affect, is one of the many factors that affect how many cases we find. It depends who you test. Let's go back to this chart real quick, because I think there is
And I
something
think, again,
interesting.
it's important to
Interesting
stress
percent.
that, because again, I'm hearing our infection rate has not been changed, it's just the number of testing.
No, that is not true. That is not true. Look at this chart. So the biggest jump in number of cases is for the week of April 19th, went from 10 to 24. There was the second largest increase ever, I think, in the state. So keep this memorized. April 19th to 26th, the cases go up. Look at the number of tests. April 19th to 26th, number of tests go down. So there is really no direct correlation. It's one of the factors that may affect that. it depends who you test. If you start testing people without symptoms, like our hospitals are doing, like we have been doing last week when we had 2 clusters in 2 retail businesses, you're going to find a lot of negative tests. That's not going to bring your number of tests up. So I think what we are seeing is really, in large part, a result of what's going on in the community.
If we see a number of our citizens that have virus fatigue, and they just get tired of the talk, the discussion, the precautions, and we all go to, and again, to pick on the farmer's market, just as an example, and last Saturday was a beautiful sunny day, and as I look across the parking lot, I see a full parking lot of people that are at the farmer's market. If we have a cluster from the farmer's market, which I hope we don't, we won't see that for 10 days to 14 days from now. So we won't really know the impact.
That's correct.
Until some point in the future.
That's correct. And that's why I said one of the limitations that we have is that right now we still do not know the impact of the increased social mobility as a result of moving into our phase 1 on about 10 days ago. It's Monday to last week. So you're absolutely right. And when you have a situation like that, it's also hard at the beginning to identify that connection. Because you may have 2 or 3 people who were infected at the farmer's market, and then they show up as a positive test result, and when our nurses interview them, farmer's market may not even come up in the discussion. So that is a challenge. I understand people fatigue. Believe me, do I have fatigue about the virus? Yes, I do. There are a couple of things I recommend people. First of all, find some time during the day, every day, where you switch the virus off. That's virus-free time. That's what I did at my house. And my wife is a good reminder, gives me good reminders about that. Time comes in the evening when I say, you know what, no more virus. We're going to talk something else. And sometimes we don't know what to talk about, because that's what we are talking about these days. And that's wrong. We can't just focus on the things gone. Let's talk about nice things we want to do in the next few months and hopefully we'll be able to do. I'm thinking about my new grandbaby who's going to be born in a few weeks. I'm thinking about what I'm going to do with my grandchildren in 3 years and take them to the beach. Let's have some positive thinking. That's going to help our mental health. It's going to help our performance. And then when you go out, just be cognizant of other people. Remember, you are not just wearing a mask and keeping social distance to protect yourself. You're doing it primarily to protect other people. You can choose to be infected with coronavirus, but you shouldn't make your choice a higher risk for me to be infected or for anyone else around you.
The other comment that I hear repeatedly is, it's not that bad. It doesn't really affect young people or people of middle age, 50 and below, that badly. Do the numbers really bear that out?
Well, you saw the numbers of hospitalizations. We did have people hospitalized in Kansas in the younger groups. Not many, but but then we don't have many cases. All you have to do is just look at what's still happening, what's happened in places where there is a very high infection rates, like New York, Seattle, Italy. And the first case recognized in Italy, who was in ICU then for about 3 weeks, was a 39-year-old man. Healthy man, no underlying conditions. It's ironic, right? Because we do know that this virus affects more severely people with underlying conditions. The very first case recognized in Italy was just a healthy young adult. It's almost emblematic to me of what may happen. So yes, statistically, you have fewer probabilities of being affected heavily and being very sick if you're young and if you do not have underlying conditions. But it's not a free passport. This virus can get nasty.
Thank you.
I have another question. Before the coronavirus, we had another flu that was affecting us. I'm not hearing a thing about it anymore. Is it still out there? Is it still affecting people? Is that people who go in and show flu-like symptoms but test negative for coronavirus, do they have the old brand X flu?
The brand flu.
Is it still out
I would
there?
call it generic now, not a brand name, because actually the COVID-19 is probably the brand name because it's newer. But I like the analogy. So it's no flu season anymore. The flu is essentially gone. There may be a few sporadic cases,
And
but
so
that's
does
not.
The flu season that's gone, does that also slow down the coronavirus flu?
No.
No.
No, the flu season was gone essentially already around the end of March, middle of March, the end of March. You know, I have my own personal sentinel surveillance system at home because I have my wife who works in an urgent care center. And I tell you, she has some days between December and January and into February that there was nothing left of her when she was coming home from a 12-hour shift because it was all flu and flu and flu and flu. And then almost like this, they were gone in part because people were also afraid to go and see the doctor. So it's not like the flu disappeared all of a sudden. But we know a lot about the flu that we do not know about the coronavirus. And one of the things we do know about the flu is that it's seasonal. It's certainly seasonal. And so you would expect not to see a lot of cases in this particular time of the year. But it will come back in the fall. And that's going to complicate cases. In fact, I have already providers contacting me and say, hey, what are we going to do in September when we're going to have flu and coronavirus together? And let's make some plans together.
I've noticed that Australia, they're going into their fall season now, and they haven't seen a real surge yet, so that might be a good indicator. I don't know, but we'll see.
Yeah. Australia and New Zealand, they really have a very interesting situation because they are countries where it's relatively easy to cordon off the entire country, and especially New Zealand, that's what they've done. But as we know, that's not going to work in a place like the United States. But much of the containment that they've done in Australia and New Zealand is based on early on not allowing people from other countries in.
Dr. Pizzino, just to kind of piggyback on that, you had mentioned the flu, and so I know I received an email from my doctor's office, I don't know, maybe a month or two ago about if you have symptoms, they would first test you for the flu, they would test you for strep throat. Because of the availability of the COVID testing wasn't there at the time. And so is that still happening? If somebody comes in and they've got a sore throat or a cough, or are they still testing for all those other things prior to getting the actual coronavirus test?
That practice may vary from place to place, from provider to provider, but I don't think it's very common anymore. As you said, that was done at the beginning, probably until, I don't know until when, but certainly it was done around February, March for two reasons. Number one, it was flu season. So statistically, it was more probable that somebody with cough and fever would have the flu than a coronavirus. And number two, there were very few tests to go around. And so we had to really use those tests in a smart way. So there was no reason to test somebody who had a flu for coronavirus. Now we have many more tests, and it's not flu season anymore. So I would expect that if anybody does that, it's probably a minority of providers.
Okay, my next question, sort of unrelated to that, there was in one of your slides you had mentioned government distrust, basically. And so I guess my question for that is, have you seen people that have refused testing? That, you know, because I mean, if you're tested, you have to quarantine for a certain number of days. Are there folks that have said, like, I don't trust the results, I don't trust the medical profession or anything, and have actually just said, no, I'm not going to get tested at all?
You know, I'm trying to think about it. There is no example that comes to mind. What we have seen is more people who refuse to stay home in quarantine. And remember, up until last week at least, we were only testing people with symptoms. Some of these people may have been already in quarantine because they were close contacts of a previous case, maybe a family member. So in their case, they were already home. If they were obeying our order, we say, okay, now you have a fever, we'll do the test. I'm not aware, you know, that would be a better question for some of our nurses who work up the phones. Not aware. If that has happened, that's really not very common. But more common thing is people becoming upset because sometimes we have to send law enforcement with the isolation or quarantine letter in their hands and say, hey, this is real. This is an order of the public health officer, and you have to stay at home. And some people simply refuse. Now, honestly, I mean, if people really refuse, that puts us in a difficult position because I don't want to send people to jail. I said that, I repeat it. I don't want to send people to jail. I'm also in charge, together with you as a Board of Health, protecting the health of the public. So what do we do?
And you had mentioned in a previous presentation that people were being tested multiple times. The average patient, when they are tested positive, how many tests does somebody typically receive? Is it, every 3 or 4 days, or when the symptoms go away, or in a lot of cases they may be asymptomatic for the majority of the time?
Right.
Do we just continuously test them until they come up negative, or?
Again, that thought has evolved the more we learn about the virus. Originally, there was a recommendation for workers who work in critical industries, particularly healthcare workers. There was a recommendation, if they are positive, then it should be retested 7 to 10 days. There were some criteria when you would retest it, and then they need to have 2 negative tests taken 24 hours apart. What quickly people found out is that there were several people who were fine, 10, 15 days, and yet they were still testing positive. And then they started doing some studies, and they saw that what they were testing positive for were viral particles that were not active. So even though they had the virus still in the back of their throat, it wasn't live virus, so they could not infect other people. So recommendation has changed now. It's really, we are discouraging people to do multiple tests to decide if people are cured or not. If you test positive once, you test positive once. Now, there are some special circumstances where people may need to be tested more than once, and that's when we do some transfers from a hospital to another facility. Those are special things that are handled at the hospital level, but as a general rule, people do not need to be retested in order to be declared cured. People are cured if they have been diagnosed at least 10 days earlier, they're free of fever for the last 3 days, and their symptoms are improving. Then they're cured.
All right, now my final question, promise. I'd like to go back to the slide about the phase 2 and just kind of clarify on that. If you have mentioned that if the governor allows us to move to phase 2, which I know she had said at her press conference yesterday that she was planning on making an announcement this afternoon,
I think
possibly
today,
tomorrow
yeah.
morning. And so if we're allowed to go to phase 2, it looks to me from this slide and that so we'll be allowing barber shops and nail salons and hair salons, bars to reopen as long as they can stay under that threshold of the mass gatherings. Is that accurate to say that, or? I mean, and I know you said there'd be some restrictions put in place. Also, kind of when will those be published?
Right. Both very good questions. First of all, let me be absolutely clear. The governor herself may impose additional restrictions on phase 2. So the governor, in fact, I don't have any special intelligence, but I wouldn't be surprised. The governor this evening says, state is ready to move to phase 2 with these conditions, though, these additional restrictions that were not in the original state plan. So let's put that aside, but everything that the governor would allow us to do, we can take into consideration. The reason we haven't developed the details of additional restrictions is because, number one, we want to see what the governor says, because otherwise we're just wasting our time. And number two, we really didn't make this decision until late yesterday afternoon. We need to look at our numbers before we can make those decisions. Right now, there is no plan to not allow in Shawnee County any business that's scheduled to reopen in phase 2 to not allow them to reopen. So another way to put it, every business that's listed in phase 2 that can be open will be allowed to be open. But some will have restrictions, and those restrictions will be decided in the next couple of days, certainly before Monday, because that's when people need to know how they can run their business.
Okay. Thank you for the clarification.
Thank you.
I just had one other question. What is the earliest you believe this virus was in the United States?
Who?
I hear different opinions now on that, and I just didn't know if you had any feeling for when it.
Yeah, I like not to use beliefs in this case. I like to use evidence when I can. You may remember back in March, I said multiple times, I believe that the virus is already in Shawnee County, even though we don't have a positive test. Turned out I was right. But when you're talking about the entire country, I really don't know. But what I have read is that there was at least one case where they were able to test some samples that were collected back in December, and that tested positive for coronavirus. I believe it was from California. So obviously it wasn't, if it was there in December, in the United States in December, it wasn't spreading the way that it's spreading now, because otherwise it wouldn't become recognized. But there is no doubt that the virus was with us several weeks at least, if not months, before it was recognized.
Any other questions? Thank you, Doug.
Thank you.
Thank you.
Good morning, Dusty Nichols, Incident Commander COVID Response. I just wanted to clarify, based on the emails and the communication I get frequently, to clarify, this will not start, the phase 2 will not start until midnight Monday. So Sunday night, Monday morning, that midnight is when the phase 2 will start, if we're allowed to go that way. Also, based on the restrictions that the governor will put down, if there are any additional ones, we're going to need time to gather that information, put out the local orders based on those restrictions and any additional ones that might come up, and the clarifications will be out as soon as I can get them out. It's going to be a long weekend putting this stuff together, and I'll try to get out as soon as I can. Just be patient and pay attention to the governor's announcement this afternoon. That's gonna give us a lot of information. That's all.
Thank you.
Cindy Evans, would you like to do your presentation?
Hazard here, getting my mask hot. There we go. Good morning, Commissioners. Cindy Evans, Director with Shawnee County Extension. Well, Dr. Pizzino gave me a good segue this morning that we need to think about other things besides the coronavirus. So in front of each of you are flowers from our Extension Master Gardeners and Ariel Whiteley-Knoll, our horticulture agent. These were grown in the greenhouse there by our office that's on the county property. And were meant for the public sale that did not happen, but our master gardeners are very resourceful and really quite a gift to the community. I hope that you saw the front page story yesterday featuring one of our master gardeners, Carol Bragdon, but she is one of 160 master gardeners that provide a lot of education that extends our reach to the community. And so we're just wanting to thank you for your service. We know that this is a difficult time for everybody, so we hope that you find some enjoyment through these flowers, and we thank you for your support.
Thank you. I think a lot more people are gardening right now. That so many people are home. I think landscaping in general has kind of picked up during all of this, and but I know the master gardeners provide a great service with the call-ins, answer people's questions, and that's very beneficial.
You're right, it is a very busy time, and we would typically have had our office open with our response line, and we have master gardeners that staff that, but we've had to go to virtual, and so people are calling in, calls, my pictures of identification, those kind of things are going through the horticulture agent and to our master gardeners who are answering those calls still. It's a different process, but we're still getting it done. So and we appreciate the public's support on that, because we're starting to get more people showing up at the door, knocking, hoping that we're going to be open yet, and we just aren't to that phase just yet. So we're still trying to respond online and with phone calls and stuff as much as we can. Very
Thank
busy
you,
time.
and thank the master gardeners for all that they do.
Thank you.
What's next?
Item 3, consent agenda.
I would move that we approve. Oh,
It's time for us to
stand up.
We're an hour.
I would move that we approve the consent agenda.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business. A, County Clerk, number 1, consider all voucher payments.
Commissioners, this morning we have vouchers a total $1,841,340.56. The voucher report, the highlights under building and maintenance, Brothers Construction, at $142,030 is the wading pool at the Shawnee North. Under equipment fund, commercial recreation specialist is $61,066.05, which was the floating structure at Lake Shawnee. And under the, we have ROD, we have the Panda Consulting, $35,500 for parcel fabric migration at the appraisal office, and Fiddler Technologies at $35,647, which is the Avid Life Cycle annual installment, ROD need register of deeds. And finally, under workers' compensation, Thomas McGee, $1,348,932.53, which is part of a large workers' comp medical claim. And those are the highlights. I do not have any questions regarding the vouchers and would move for their approval.
Second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item 2, consider correction orders.
I'll move for correction orders.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B, corrections. Number 1, consider approval of request to fill a vacant juvenile intensive supervision officer position at a salary including benefits of $66,089.79, maximum depending on the seniority of the chosen candidate, with funding from the Kansas Department of Corrections Juvenile Services.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. This is due to the recent resignation of a person that works at the Community Corrections. This is an existing position. We're just asking permission to fill it. The money is already there. This is not a new position. Their funds are available. Come through the money that's provided by the Kansas Department of Corrections. Be happy to answer any questions you may have.
Any questions?
No, I have none.
I'll move for approval. Second. Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0.
Thank you very much.
Thank you, Brian. Next item.
Item C, facilities management. Number 1, consider approval of request to fill a vacant maintenance tech 1 position at $16.95 per hour plus benefits with funding from the facilities operations budget.
Good morning, Commissioners. Bill Kroll, Facilities Maintenance Director. This position is a position that was held by Don Bell, who transferred over to the Health Department lead position back in March. We did have a great number of applicants, especially coming in after the layoffs and things started taking place, and the rates for those applicants were a little higher than we normally pay. We do have an applicant that is willing to accept the job at a reduced rate from what he's making now due to county benefits, and this would reflect that. We'd like to get him on board as soon as we can.
I'll move to approve.
Second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0.
Thank you.
Next item. Thank you, Bill.
Item D, elections. Number 1, consider approval of the Help America Vote Act COVID grant applications from the Kansas Secretary of State for the 2020 federal election cycle in the allocated amount of $154,790.27 to Shawnee County.
Good morning, Commissioners. Andrew Howell, Shawnee County Election Commissioner. As you can see, we're probably going to have this completed shortly, but we wanted to get your okay on it. It's going to be about $155,000. We expect to actually spend every bit of that and probably a little bit more with all of the kind of question marks and expenses that we expect holding an election with COVID being part of the program. So if you have any questions on the details, like I said, I expect we'll be working with Betty and Jim to accomplish this, to make sure we're maximizing dollars on behalf of the county. But I can actually give you just a little bit of insight into the kinds of things. I think it's attached, but we expect to be spending some money on cleaning supplies, additional ballots and envelopes. Overtime, I think we're going to have additional overtime as a result of COVID. Training of poll workers on sanitation, mailings to inform the public, post and pre-cleaning of election locations. I think will take some time and effort, and a little additional expense there. Possible leasing of new polling places. There's a pretty large number of things that the money can be spent on, but like I said, we'll probably be spending some time with Betty and Jim kind of going over, making sure that we're maximizing that on behalf of the county. So happy to answer any questions if you have.
Mr. Chairman?
Yes.
Andrew, I know this is going to be a different election year than we've ever encountered before. Just the whole process. I'm sure Dr. Pizzino would frown upon political candidates going door to door, knocking on everybody's door. That might be, it's frowned upon by many just to begin with, but now with the virus, it will probably even be more frowned upon. But just going into our election cycle, and I know that the primary in August is many months away, our general in November. Again, we're quite a ways out yet. But what sorts of things do you anticipate from the elections office or forecasting ahead? Are you looking at trying to get more people to register to advance ballot, more people to register by mail? What is the kind of the direction the elections officers are being kind of being informed of across the state and from the secretary?
Well, one of the things that I know we've talked about internally, and I would encourage the public to do this, is to look at your actual registration and make sure it's current, make sure it's correct. We know that somewhere between 6,000 and 10,000 voters in Shawnee County we don't have the correct information for. Now, what I also don't know is those may be people that have moved out of state and just simply haven't told us. So we really can't jump to any real conclusions about those registrations. But I absolutely do encourage people, for a number of reasons, check your registration, call us if you need to, make sure it's accurate, make sure that it accurately reflects the location that you live. Because as we're communicating with people, I really don't want to be sending out and spending tax dollars, communicating with people, sending out mailers, sending out applications, all the kinds of things that we're going to have to do. I don't want to send out mail and then have it not get there to the right person at the right address. So I really do hope people will take that into consideration and get their registrations correct. Additionally, I think over the next 2 to 4 weeks, we'll be communicating with the public and with the county commission about specific plans, but we kind of need to get through this document first before we really can kind of finalize our plan on what we expect to see in this election as far as how we're going to spend money, how we're going to communicate with voters, how we're going to set up polling places, all the things that I know there are many questions on. One of my challenges is I really don't want to throw a theory out as to how we might do it and then change it, because I worry about bad communication with the public as it relates to exactly how we're going to do the election. And as we've all witnessed, the virus and how we interact and kind of the level of access and ability to move in large gatherings, those kinds of things all affect how we plan and how we'll ultimately do it. So we're still studying a lot of that. But I do expect over the next 2 to 4 weeks to meet with commissioners and then kind of to release publicly a lot more details on exactly how we'll execute some of those things or how we're planning to. Again, keeping in mind this could change a lot despite planning, but we're trying to manage a little bit more closely maybe than normal exactly how we release the information so that we don't have confusion of voters as to exactly where to go, exactly how to access their information.
Thank you. I just know that over the last 6 years or so, we've seen a huge increase in advanced voters. And I know that every year when we talk about your budget, that when that trend really kicked off, we saw that increase in your office with people that were coming to vote early. And so as we go into this new era, looking at how we're going to tackle advanced voters, that's going to be key in making sure information is out there.
I think it's important that people know that really nothing has changed in many ways as it relates to voting. We're still going to do advanced ballots like we've always done. That's still going to be a component. We're still going to do early voting at some level, and I don't know exactly how that'll look yet. And we're still going to be doing election day. And again, that may change some, but we're still going to be offering all 3 of those options to every voter. So it may change in how it looks in detail, but we're still going to be offer applications and ballots, advanced ballots that people can receive through the mail and then get back to us, as well as the other 2 options. So I hope to get a little more detail out to the public as to how we see that looking, but I think it's important for people to know we cannot do just a mail ballot program. The law doesn't allow for that. You have to turn in your application, and then we have to do what we've always done, send the mail ballot to you once it's requested. And then we'll be talking more about those other 2 options once we get a better sense of exactly how we're going to execute on that.
But mail ballots have always been an option, so if a person is maybe limited or has mobility issues or just doesn't want to go to a public polling place, they've always had the option of advanced voting by mail. And if a person has concerns about the virus, this is an option for them at this point to start
Yes,
thinking
yeah,
about.
you're correct. I do, and again, it's really driven by what the public wants. It's not up to me particularly as to which method of access people choose to use. They can request a ballot and we'll mail one to them. That's always been an option. Same thing about voting early. It's always been an option. And same thing about election day. It's always been an option. So in many ways it hasn't changed, but I would guess, and this is simply just a guess on my part, that more voters will choose to use the advanced mail application process and receive their ballot at home due to COVID-19. So I expect that we're looking at an increase in use of that just based on the information and what we're seeing.
If that does happen, just please communicate with the commission so that we have an anticipation on our budget, because I know that will hit your budget differently in mail costs.
Yeah, I think one of the things that we're still trying to figure out is it's going to actually, if it's a significant change, then there will be some difference in the actual cost, because we'll have to have teams of Democrats and Republicans who are going through every ballot and using all those safeguards that we have in place. So it will change up staffing requirements and some of those things. So as we get a better sense of that, we'll certainly come and visit with the commission and let the public know kind of as it progresses, because I think communication is going to be an important part of how this, all gets pulled off, quite frankly. So.
Thank you.
I had one question on the amount of the grant. Is this a max that we can apply for, or where did this number come from?
That's a max amount that's come to us from the Secretary of State's office. It's basically any money that we have spent or anticipate spending in 2020. And so like I said, we'll be meeting with Betty and we'll be meeting with Jim and trying to make sure that we're maximizing the opportunity for those dollars to make sure that we are, fully using the ability that we have to help, like you said, on some of those additional costs that will probably occur this year.
I'll make a motion to approve.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner May. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item D2, consider approval of request to realign classified positions within the department with no increase in funding to the election office 2020 budget.
Commissioners, one of the things that we've noticed, we've kind of been studying this for a year or two, the amount, the positions that we have in the office and the amount of work and the way that work is done has changed quite a bit since 2004, when a lot of our position definitions were kind of updated. So we thought it was time to go through and really look at all the changes that have occurred in elections since that time. A lot of our processes require a little bit more work and a little bit more time. We saw that in 2016 with the pretty substantial overtime that occurred in that year. Additionally, we're seeing a lot more requests for Cora, a lot of time involved in those open record requests that we get. Ballot preparation processes take a little bit longer. But part of what we think that we can do, and I want to assure you that we don't expect any increase in personnel costs as a result of this. We're really trying to manage the workload and the exact tasks that need to be done, and we think we can do that with one additional person and still not end up increasing our personnel costs. So that's our commitment, again, is to work with Jim and Betty to make sure that we get that done.
Questions? Just one other question. Are we expecting a big turnout this year in this next election?
I'm expecting a fairly large turnout. It's somewhat complicated, by the question marks, I think, of COVID-19 and how people will perceive or choose to proceed on an individual basis. But yeah, I would expect somewhere near the 72% that we always see in a presidential election. It's usually in excess of 70%, and it's always been within a couple percentage points of that. I think it was 72 to 73% in the last two presidentials that I've been involved in.
Any issues with finding polling places or anything?
I think we've had a couple of places drop. To be honest with you, I'm kind of waiting until we get a little bit more clarity going forward before we do a lot of contact and a lot of conversations. I do anticipate that we will probably spend some of this money that we talked about earlier, making sure that we are doing deep cleaning before and after at any polling places, and really working at making sure that our polling places are kept clean and kept safe, and we use masks and gloves and all those kinds of processes at a polling place. So we're kind of trying to work. I think we're going to lose some nursing homes. I think that would be a pretty reasonable assumption at this point. So we'll have to see going forward kind of how this all plays out. But I do think there will be some issues there.
I'll move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Thanks.
Thank you, Ron.
Item E, Sheriff's Office, number 1, consider approval of request for a position reclassification from an account clerk 1 to an account clerk 2 at a salary including benefits of $66,069.10 with funding from the 2020 departmental budget.
Morning, Commissioners. Caleb Acree, Administrative Captain for the Sheriff's Office. This request, along with the position description that was sent over with this request, has been reviewed, vetted, and approved by Human Resources as well as Audit Finance, that it is within our budget. This request kind of came about in doing exactly what Mr. Howell had just said, reviewing some of our position descriptions. We noticed that our current accountant, one, had been in her position for 3 years, and a lot of the work that she was doing is directly in line with the accountant 2 position description. So that's kind of what facilitated the request before you.
I'll move for approval.
Second.
Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor, say aye. Opposed, motion carries 3-0.
Thank you.
Okay. Next item.
Item 5, Administrative Communications.
Do we have anyone from the public who would like to speak at this time? Or department heads?
Good morning, Commissioners. Aaron Mahan, Shawnee County Emergency Management. Just wanted to give everybody an update on the weather, which hopefully you've been paying attention to. We are expecting some storms to move into the area after about 2 or 2:30 this afternoon. Throughout the late afternoon and evening, they could be fairly severe with some high winds, rain, hail, and I've heard there's a potential for tornadoes. However, hopefully that remains fairly low. Overnight, we're just mainly looking at heavy rains, as well as over the next couple of days, which could cause some flooding concerns. So we'll be keeping an eye on that and pushing out information as needed. I would encourage everybody to pay attention to their social media pages, their local media pages, and if they have any questions, to give us a call. Thank you.
Thank you, Aaron. Anyone else? Well, Commissioner Mays, do you have anything?
That's what the Mays.
Commissioner Cook?
Well, last night we had a meeting by Zoom for JADO. It was a first for JADO to do by Zoom. And I want to thank Mark Price for all of his hard work, and over at the city staff. All the audio worked, all the visuals worked, all the technology worked, and that in itself is a major feat. And everybody was able to participate. We did have enhancements of 2 proposals that were approved, adding more jobs to Shawnee County. And I think that's a great impact. And also, we have had over 1,400 workers that have been impacted by the host program by receiving gift cards and other amenities to kind of offset the costs of through the virus. And those are all private donations that have come through the community. So just really want to thank everybody for their participation and their work. And I don't know that I want to do every meeting by Zoom, but it worked okay last night.
It was encouraging to see the business community continuing to grow and
Yes.
Move forward, even with this virus attacking us at this moment. But I think people see the light at the end of the tunnel, and we'll come through this better than before. So, anyway, anything else?
No, thank you.
Well, I just want to tell you I have a new granddaughter. That's where I've been spending my extra time here. Annabelle Kathleen Rippon arrived Monday, and we're glad to have her. Her and Mom are doing great. So that's all I have in that realm. I would like to make a motion to go into executive session for a period not to exceed 2 hours for the following reasons. To discuss personnel matters of non-elected personnel. Specifically, we will be holding 2 departments try to start those at 10 o'clock. I'm going to try to get one in now, and then we'll do one a little later. We also have a need for consultation with an attorney for the public body or agency which would be deemed privileged, and an attorney-client relationship, specifically to discuss pending litigation. This will be for 50 minutes. We have a hard start time of 11 o'clock. Is it the prearranged call-in situation? So that one will start 11. After that, we'll probably do the other evaluation. And then we also have a need for consultation with attorney for the public body or agency which would be deemed privileged, and attorney-client relationship, specifically to discuss pending workers' compensation claim. This item will be 10 minutes. So let's start in about 5 minutes, and let's do. Oh,
Do you want to just make it an even 12:30, just to be,
let's do that.
so we'll, our executive session starting
10:30.
at 10:30,
Let's say
going to 12:30.
that works.
That's second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor, say aye. Opposed? Motion carries.
Cindy, is there anything that I need to sign?
Yes, I have a resolution.